Okay, let's move on to part two of our seminar. That's how to save a life by using naloxone. So I have a few learning objectives in this section of the course. First is that you know how to recognize the signs of an opiate overdose. Second, what the 5 simple steps are that you can administer to save a life, including how to use naloxone. And then we'll talk about where you can get naloxone and a few other things that are important, like the Good Samaritan law that protects bystanders who administer naloxone. So the first thing we want to talk about is how to recognize an opiate overdose. So I'm going to show you a slide or two, and then what I'm going to do is show you a video that will actually show you somebody who's in an opiate overdose. So if you come across somebody and you try to wake them up and they're not waking up, there's a pretty good chance they're in an opiate overdose. And so and we'll say this before we get into the 5 steps. There's 5 steps that we talk about. If you apply them to somebody who's not an opiate overdose, it's not going to hurt them. So if in doubt, I would recommend that you apply the 5 steps. But let's talk about first, how do you recognize somebody who might be an opiate overdose? Well, first of all, if you approach them, they're not waking up and they're either not breathing or their breathing is shallow, then there's a pretty good chance. Some other things to look for: face is extremely pale, clammy to the touch, body is limp, fingernails or lips may have turned blue or purple. The patient may be vomiting or making gurgling sounds. If so, make sure you get them on their side. He or she cannot be awakened from sleep or is unable to speak. Breathing very slow or stopped. Heartbeat slow or stopped. Okay, so let's take a look at a video on this.
Let's begin with understanding what an opioid overdose is and how it affects the body. Opioids work by interacting with receptors in our brain. The opioids fit into these receptor sites, sort of like a key fits in a lock. What makes opioids potentially so dangerous is that these same receptors ensure we keep breathing. An overdose happens when more and more opioid molecules latch onto these receptors, overwhelming the brain's ability to keep us breathing properly or even at all. Because someone suffering from an opioid overdose may appear to be simply sleeping, it's important to know the signs to look for. Specifically, breathing becomes very slow and shallow, erratic, or has stopped. Snoring or gurgling sounds are made. Pupils become pinpoints. There is a loss of consciousness. The person is unresponsive to outside stimulus. The body is limp. Pulse is slow, erratic, or not there at all. The face is pale and clammy. Fingers and lips turn blue or purple, and the person may also experience vomiting. An opioid overdose deprives the body of oxygen, which can cause vital organs, especially the brain, to shut down. After 3 to 5 minutes without oxygen, brain damage starts to occur, soon followed by death. Fortunately, there is a medication that can temporarily combat opioid overdose symptoms, buying critical time for paramedics to arrive. Naloxone is a competitive antagonist to opioids. It works by knocking the opioids off the brain receptors they've latched onto, allowing the person to breathe again and temporarily reverses the overdose.
All right, so I hope you can all see how you might recognize an opiate overdose. And, essentially if somebody's not breathing or breathing irregularly and you have a hard time waking them up, or I should say can't wake them up, then the likelihood is they're in an opiate overdose. So you should follow the 5 steps we're about to cover. Okay, so the 5 steps. First, we're going to stimulate the person. If you think back to that video that you just watched, where the woman comes in and she rubs her knuckles into the person's sternum. She's doing that very aggressively, enough so that it hurts. And if that's not waking somebody up, then the chances are they're in an opiate overdose. So you want to stimulate them then you want to call 911. And you want to, if you leave for any reason, place the person in recovery position. And we'll go through each of these in a little more detail in a minute. If you have naloxone, administer it. If the person has not started to breathe on their own after giving naloxone, or if you don't have naloxone, then we want to support the person's breathing either through rescue breaths or CPR if you know it. And lastly, but certainly very important, stay with the person and ensure that they go for medical help, even if they start to breathe on their own. Okay, step one, stimulate. So here's a picture of a woman stimulating this person here by rubbing her knuckles into the person's sternum. You can also rub it into the person's gums. And so if someone is unresponsive, try to wake them up, call their name, or say something like, I'm going to call 911, I'm going to give you naloxone. If that does not work, stimulate with enough pain so they feel it into the sternum or into their neck or into their gums. And if that does not wake them up, then you want to go to step two. Step two is to call 911. Just a little note, if you leave the person at any point, make sure you put them in the recovery position. That's essentially getting them on their side. So when you call 911, what you want to say is, I'm with the person who stopped breathing. The fear of saying I'm with somebody who's had an overdose is the stigma issue. It may not get the same level of response and interest as if you say, I'm with somebody who stopped breathing, and then be very specific about where you are. Because time is of the essence here. We want the first responders to find them quickly. So if you're within a particular address and a particular floor and room, make sure you're very clear so the first responders can get there very quickly. So as I mentioned, if you, for any reason, have to leave, put the person in a recovery position. So essentially, you're going to get them on their side, but there are some techniques that are listed here. Tilt their head back, turn to one side, bend their knee against the floor, and just to give them some stabilization. The main reason you want to put them on their side is in case they aspirate or in case they vomit, and then the risk is that they could aspirate or choke on their own vomit. So never want to leave a person alone on his or her back if you think they're having an opioid overdose. The other thing that you should keep in mind is that there is, in Massachusetts and most other states now, a Good Samaritan law that will protect people from criminal and civil liability. So a lot of people who are with people who overdose are also using themselves. Historically, they were concerned to call because they were afraid they'd get arrested for using. So the Good Samaritan law is basically intended to encourage people to take action, encourage people to call if they're witnessing an overdose. And when the first responders and police show up, they're not going to arrest somebody for simply being high, for simply having a small amount of drugs on them. The other people that it protects are people who are acting in good faith and come across somebody who's had an overdose, walking down the street, you're in a particular venue, you see somebody who you think has had an opiate overdose, as long as you're acting in good faith and following the process, then you're not going to be liable civilly as either. So that's what the Good Samaritan laws are, encouraging people to take action and removing the fear of either criminal or civil law. So the third step is, if available, administer naloxone. This is also called Narcan. If not, you're going to go to step 4. But let's talk about step 3, naloxone. So there are basically 4 types of naloxone on the market, but really the key one is this one over here called Narcan nasal spray. But we'll talk briefly about each of the 4 kinds of Narcan or naloxone that are on the market. So there is a nasal Narcan that is has 4 milligrams of naloxone in there, and that is the one that is most commonly used. And we'll go through how to administer this, but this is basically administered nasally. And here is also an approach to administer it through the nose. But this one, which has been around for a long time and has saved many hundreds of thousands of lives, so they all do the same thing. They all have the same drug, but this is also administered through the nose. But it does require assembly, and it has less naloxone than the more current version of nasal Narcan. So it has about half as much naloxone in each container. So And then there was a third kind that came on the market, and this is a injectable, very easy to use. You pull it out, and some people call it the talkie because it'll walk you through what you have to do. Unfortunately for the injectable or talkie, the price of it is so high that it really is unaffordable for most people. So it has not become a main player in the bystander market. So there may be some healthcare facilities that use it, but generally speaking, bystanders like you and I and others are going to probably almost always have this nasal Narcan, or they may still have some of the older form of nasal Narcan as well. But we're gonna show you how to assemble, how to use both of these. And the fourth kind is a syringe based, and so syringe based is highly effective. But people aren't going to typically not going to carry around syringes, and they neither want to administer them or enjoy receiving them. So these are generally used by paramedics and by healthcare facilities, but most of the medical facilities right now actually have this nasal Narcan because it's easy to use, has twice as much naloxone as any of the other products on the market. And so let's take a look at how you can use these two forms of nasal Narcan. Now, I will say that both forms of every drugstore in Massachusetts is required under ordinance to carry Narcan. Almost all drugstores are going to carry this nasal Narcan. Some may carry the older version of nasal Narcan. If you have a choice, you want to go for this form of Narcan because it has twice as much naloxone as this product, and it's also much easier to use. But let's look at both, and then
I'd like to go over how to use your naloxone product. It can be really difficult in an emergency situation to remember everything that you may have learned about naloxone. So feel free to come back to this video from time to time to review the information here so that you can always be prepared in the event that you witness an opioid overdose. So you've called 911 and grabbed your naloxone. Now what? This is intranasal naloxone in a pre-filled syringe, and it requires a nasal atomizer for administration. Each box contains 1 dose of naloxone, and when you open it up, it looks like this. Now the first step to assemble your dose is to remove all the colored caps. So there's 2 yellow caps on the syringe and 1 purple cap on the drug vial. So now that all the color is gone, we can twist the drug vial onto the syringe. And the most important thing to remember at this point is not to push on the vial at all while you're twisting. This causes some of the drug to leak out of the end. So you want to twist without pushing until you meet resistance. And then you'll take the nasal atomizer and twist it onto the other end until you meet resistance. And now your dose is ready for administration. There's 2 important things to remember when giving a dose of intranasal naloxone. The first thing is that we're going to try and split the dose between both nostrils. This means you're going to give half the dose in one nostril and half the dose in the other nostril. Now, there is no way to accurately measure half a dose of naloxone. There's no mechanism on the device that will stop you halfway, so you're going to have to estimate, and it's okay if it's not perfect. Just do your best to administer half the dose in one nostril, half the dose in the other nostril. The second thing to remember is to push vigorously on the drug vial when you give your dose. This allows the medication to form a fine mist that is easily absorbed in our sinuses. If you press too gently on the vial, the medication forms droplets at the syringe, and it does not absorb as well in our sinuses. So push vigorously and give half the dose in one nostril, half the dose in the other nostril. Firmly place the applicator into the patient's nostril so that a seal forms, and vigorously push half the dose in one nostril and half the dose into the second nostril. And that's how you use intranasal naloxone in a pre-filled syringe.
Okay, so what we saw was the older version of nasal naloxone. Requires assembly and has half as much naloxone as the current nasal version does. With that said, it was so effective for so many years. It was the only thing on the market that was available generally to bystanders, and it has saved hundreds of thousands of lives. Fortunately, something has come along that is has twice as much naloxone and is much easier to use. So let's take a look at the current, probably the industry standard for bystanders, which is called nasal naloxone. And this is probably, if you decide you want to carry naloxone with you, this is probably what you're going to want to get. So I will say this, that naloxone is available in every pharmacy in Massachusetts by law, and it's also available with or without a prescription. So there's a standing order across Massachusetts that says that anybody who walks into a pharmacy has a right to acquire naloxone, and your insurance company will pay for most of it. There usually is a copay, but your insurance company will pay for it. And if you're on Mass Health and know somebody on Mass Health, I believe it's free in Mass Health, but every form of insurance will cover at least a portion of it in Massachusetts. And okay, so let's take a look at that, and then we'll talk a little bit about the other step.
This is Narcan nasal spray. It comes in a box with 2 doses. You're going to take 1 dose out of the box, remove it from the packaging, and the applicator goes in 1 nostril, and you're going to depress the plunger with a quick, firm push. When putting in the applicator, you'll want to form a tight seal with the patient's nose so that the medication goes up into the sinuses and does not come down the face. And then with a quick, firm push, you're going to administer the medication. There's no need to depress the other nostril. You can leave it open. And if a second dose is needed, you will apply it in the other nostril than the one that the first dose was given in. And that's how you use the Narcan nasal spray.
So what I want you to note here is how simple and easy it is to use. You take it out of the packet, you insert in the person's nostril, and you push down the plunger. And I will tell you that in Massachusetts, every day, 50 to 60 people have their opiate overdose reversed through nasal naloxone. So it's a major intervention that saves, it saves thousands of people across the country every month, and if not every day. So what we know about is that there are roughly 5 to 6 overdoses in Massachusetts every day, fatal overdoses. But we also believe that there are 50 to 60 reversals through nasal naloxone administered by bystanders, family members, people walking by who know how to recognize and respond to an opiate overdose. So I'm hoping some of you will consider getting and carrying naloxone. It's relatively inexpensive. You can go to any drugstore in Massachusetts, and with or without a prescription, show your insurance card, and you'll be responsible for the copay, unfortunately. But then you can carry it with you, and if you see somebody who you think needs help, then you'll be able to administer it. Or if you're in a relationship or know somebody who you think is at risk, then you might be the person that ends up saving somebody who who is very dear to you. So in any case, this intervention, this public health intervention, has been a major factor in at least before COVID, in leveling off the number of opiate overdoses. So what we saw in Massachusetts was a steady increase in opiate overdoses until about 2 years ago. And most people believe that the reason that it leveled off about 2 years ago at about 2,000 people a year dying in Massachusetts is that there was more widespread availability and use of naloxone. So please consider being one of the people who joins in the thousands of people across Massachusetts who decided to carry naloxone just in case there's somebody who needs their help. Okay, so step 4 is to provide rescue breathing. So if you have naloxone and you've administered it and the person is still not breathing, then you want to provide rescue breaths, or if you know it's CPR. So the Boston Department of Public Health gives this advice. If you know CPR and the person's not breathing, you should use CPR. If the person is breathing, or if you don't know CPR, then you should do rescue breathing. So rescue breathing is a very straightforward and much less intrusive form of intervention than CPR would be. But rescue breathing essentially is, we'll demonstrate that in a minute, but here's some pictures of it, and then we'll watch a quick video on it as well. So basically, you want to lay the person on his or her back. You want to open their airway, and then you want to tilt their head back gently, open their mouth, make sure there's nothing obstructing their breathing. If there is, you want to remove it carefully. You probably want to protect your hand with your sleeve or if you have gloves, because if it's a fentanyl patch, then that can be very dangerous to you. Then you want to pinch their nose and create a seal with your mouth over the other person's mouth and give 2 small breaths, enough so the chest rises. And you want to continue that every 5 seconds for about 2 to 3 minutes. And if the person's still not breathing on their own, then you have an additional dose of Narcan, then give them the additional dose of Narcan. If you don't have any additional doses of Narcan, or you don't have any at all, just do the rescue breathing. Okay, so let's watch a video on this.
In this portion of the Pharmacy Pearls Opioid Overdose Education video series, we're looking at how to respond to an opioid overdose. Previously, we stressed the importance of calling 911 for help. Now we'll focus on performing rescue breathing. For a person who is not breathing, rescue breathing is an important step in preventing an overdose death. When someone has stopped breathing and is unresponsive, rescue breathing should be done as soon as possible because it is the quickest way to get oxygen into the body. Steps for rescue breathing are: place the person on his or her back and pinch their nose. Tilt the chin up to open the airway. Check to see if there is anything in the mouth blocking the airway. If so, remove it. Give 2 slow breaths, blowing enough air into the lungs to make the chest rise. Turn your head after each breath to ensure that the chest is rising and falling. If it doesn't work, tilt the victim's head back more. Breathe again every 5 seconds. When performing rescue breathing, you can use a CPR mask or mouth barrier containing a one-way filter valve to protect yourself from the victim's potentially infectious bodily substances such as vomit or blood. Finally, rescue breathing should be continued until the person can breathe for themselves or until help arrives. Thanks for watching. Please stay tuned for the next edition of the Pharmacy Pearls Opioid.
All right, so hopefully you're comfortable with the idea of what rescue breathing is and how to provide it. So the fifth step is one of just staying with the person until medical help arrives. So what often happens if somebody has started to breathe on their own through the intervention of naloxone or rescue breathing, they're going to want to get up and leave. It's really important that you try to get the person to go with the EMT people to a medical facility. And the reason is this, that because of the powerful nature of opiates, sometimes when a person has been able to be revived through naloxone and the opiate receptors have been knocked off the brain, what happens is that the naloxone wears off after an hour or two, and if there's enough opiates in the body, they can reattach to the brain, and the person can have a second overdose even without having taken any additional opiates. So it's really, really important that you get the person to go for medical help. Okay, so here's a recap. Stimulate, call 911, administer naloxone, provide rescue breathing. And I may not have mentioned this, but let me be clear that you want to keep administering naloxone to the full extent that you have it. Providing naloxone 1 dose, 2 doses, 5 doses, 10 doses, not going to hurt the person. And there are many cases where people need several doses of naloxone before they're revived. If you leave for any reason, make sure you put the person in a recovery position so they don't aspirate, and make sure you stay until help arrives. Okay, so hopefully this was all very helpful to you in understanding how to both recognize and respond to an opiate overdose. Just a couple of other things that I want to reiterate. The liability, both civil and criminal, is minimal because of the Good Samaritan laws. You can get naloxone, you can go to your doctor and you can ask him or her for a prescription. But you can also walk into any drugstore in Massachusetts, and with standing orders, you can get naloxone, and your insurance typically will cover a big portion of it. So if you look at the nasal Narcan, that is pretty much the industry standard now, then that sells without insurance for about $125. It comes in a 2-pack. Typically, your insurance will cover most of that. And so you can walk in today to any CVS or Walgreens or whatever near your house, and you can pick some up. And it would be wonderful if many of you did just that. Okay, so all right. So I hope that answers all of your questions. But there are a few more things I want to. So naloxone can be used to reverse all overdoses. Unfortunately, no. It's really just for opiates. Can you give multiple doses? Yes. If the overdose is reversed, should the victim go to the hospital? Absolutely. Very important. If a victim's wearing a fentanyl patch, which I do, remove the patch with your covered hands. If you're carrying the older version of intranasal naloxone that requires assembly, can you do that in advance? You can, but it limits the shelf life. Can naloxone be administered to pregnant women? Yes, it can be administered to pregnant women, it can be administered to senior citizens, to children, okay, to animals. And can you keep naloxone in your car? Well, you can, but ideally you keep it in a cool, dry place. But the bottom line is you want it with you. So there is no known side effects to naloxone. There's no risk of addiction or hurting somebody. Can't get high with it. So, all right. So I hope this training was helpful. And by all means, if you have any questions, please feel free to reach out to me at any time. Thank you for listening to these 2 sessions.